So the first thing I'm going to test is your testing your visual acuity with the Snelling chart. I'm going to hold this back here and I'm going to have you read the bottom, as the lowest line you can read on this chart.
Okay. I can't see the bottom that well, so I'll go one above it. T, F, D, O, P, Z, L, E, C.
Good. Perfect. Now I'm going to check your near vision. I'm going to have you use this magazine. I'm going to have you hold it 14 inches away, and I'm just going to have you read what this says, that first sentence.
Savings past discount doesn't apply to the items on these pages.
Perfect. Okay? So you have 20/20 vision, which is good. Next, I'm going to have, I'm looking at your eyebrows, which extend from the inner to the outer part. Your eyebrows are nice and full, and they're symmetrical. Okay. Now I'm going to look at your eye. I'm going to take these off for a second. Now I'm going to look at your eyelashes. Your eyelashes are, the top and the bottom eyelashes are outward, which is good because you don't want them to be inward. Your eyes are symmetrical. Your sclera is very white. Now I'm going to check so I'm going to shine this light in the middle. So the light is symmetrical in both eyes. Now I'm going to check your pupils. I'm going to have you look straight ahead, and I'm going to shine this light in your eye to see if it constricts, which it does. That's the direct response. And then I'm going to do it again and see if the other eye does the same thing, which is considered to be consensual response. Which it does also constricts, which is also a good sign. Your pupils are round, reactive, and equal to light. So now I'm going to have you look across the room. I'm going to check your accommodation. I'm going to have you look at my finger, and I'm going to have you. Now I'm going to do accommodation. I'm going to have you follow my finger. Okay, good. That's good. And then I'm going to have you. Next, I'm going to do a test to check the muscle balance. I'm going to have you follow my fingers with your eyes and not your head. So don't move your head. I just want you to move your eyes. And it's going to be the shape of an H. So we're going to go lateral. We're going to go up, and then we're going to go down. And I'm going to come back here, and I'm going to have you go across and up and down. Good. That was perfect. Your eyes are both following my finger. Your extraocular movements are intact. Next, I'm going to check your peripheral vision. So I'm going to have you cover one eye, and I'll do the same. So I'm going to have you cover your one eye, and I'm going to do the same. So now I'm going to wiggle my fingers, and you tell me when you can see them.
I can see them.
Okay?
I can see them. I can see them. I can see them.
Okay. Now we're going to do the other eye.
I can see them. I can see them. See them. See them.
Okay. Your peripheral vision is better than mine, so that's good. Okay. Next, I'm gonna look into your ears, so your ears are symmetrical, which is good. And the outer campus of your eye, if I was to draw a line and put it to the top of your ear, it lines up absolutely perfect. Your ears they're supposed to be about 4 to 10 centimeters, and they look about that. I'm just going to pull back your ear. Is there any tenderness when I do that?
No.
Okay. I'm going to feel your mastoid process. Any tenderness there?
No.
Okay, now I'm going to look inside your ear. I have the video on. Now I'm going to look inside your ear. You can see the small fine villa hairs. You can see the tympanic membrane is intact. in the cone light I can see. Okay. The bony prominences are also there. So I'm going to do some tests at first to check out your hearing is what I'm going to do. I'm going to have you cover the ear and then I'm going to, it's called the whisper test. So I'm going to have you cover your ear and I'm going to come over here. I'm going to have you cover this ear. And I'm going to say 3 words and you have to repeat the 3 words that I said. Okay, what were the 3 words?
Dog, cat, sheep.
Perfect. Okay, so now, next I'm going to do a test here. And the 2 tests that I'm going to do next, they're with tuning forks. So the first one I'm going to put on top of your head. And you're just going to let me know if you hear the vibration. Why is this working? The vibration. Do you feel the vibration?
Yes.
Okay. Next I'm going to put it on your mastoid process. And I'm going to have you tell me when you no longer hear the noise.
Just stopped.
Hold on 1 second.
Stopped.
Now, can you still hear it?
No.
Okay. Okay, so that's good. Alright, so next I'm going to have, okay, so we did that. Your air conduction, which is what I was testing, your air conduction and your bone conduction. So your air conduction is supposed to be, your air conduction was about 20 seconds and your bone conduction was about 10 seconds, which is normal. The ratio is supposed to be 2 to 1, so that was perfect. So now I'm going to examine your nose. So I'll probably use this. Yeah, this one's good. So next I'm going to have your nose is midline, which is the way it's supposed to be. I don't see, I'm going to feel the sides of your nose. Does this tender at all?
No.
Okay, so no tenderness, that's good. I'm just going to take a look inside your nose. So I see small villa hairs. The mucosa is nice and pink and moist. The lower turbinate is dark pink. I don't see any drainage or discharge. Next I'm going to palpate your sinuses. Okay, so these are frontal sinuses. Is this tender at all?
No.
Okay. Next I'm going to test your maxillary sinuses. Is that tender at all?
No.
Okay. Good. So you have no tenderness inside your sinuses, which is a good sign. Now I'm going to look at your mouth. So I'm going to have you smile. Show me your teeth. Your teeth are nice and white. I'm going to pull back a little bit just to check your gums. Your gums are nice and pink and moist, which is good. I'm going to have you open your mouth. Your hard palate is good. Stick out your tongue. Okay, good. It's midline, which is what we want. This first tongue. Stick out your tongue, and that's midline. So next I'm going to have your soft palate was also pink and moist. So next I'm going to have you lift up your tongue. I just want to look underneath just to see if there's any lesions, which I don't see any. I don't see any cavities. And then stick your tongue out all the way just so I can check to see if your tonsils. And go, which I don't see any tonsils. So, and that's good. So that's all for today. Just had to check your nose, your ears, your mouth, and we're all set.
Thank you.
Thank you.